Hi, I'm Joe Cannon from supplementclarity.com, and in today's video I want to cover a very controversial topic called Kratom. And if you've ever heard of this, you've probably seen all kinds of stuff on the internet about how it can help pain levels and help you exercise better, etc. I've gotten a lot of questions about this and have looked at the research, and I want to try to condense a lot of that research into this video. Before I go any further, I want to let you know I don't have an agenda. I go where the research takes me. And so I just want to be upfront and say that, because when I look at various websites, I see some websites are very pro-kratom, some websites are very anti-kratom. I'm not either. I just want to give you the best information I possibly can to help you make the best decision for you. So some topics I'll include here we're going to go right to the research. I want to talk about what that research says and doesn't say. I'm an exercise physiologist, so I want to deal with the effect of kratom and exercise. Does it have any? How much might work for people? Talk about side effects, drug interactions, and try to address whether or not kratom is addictive or not. So right off the bat, let me just give you a quick overview. What is kratom? It's a tree, grows in various parts of the world, related to the coffee plant. And on the internet, it's promoted to help a bunch of different topics, mostly help relieve pain and maybe help people get off pain medications. But it's also marketed in some places to be a treatment for various pain disorders like fibromyalgia and arthritis, perhaps even diabetes, which I want to talk about in a moment. And you name it, they'll claim it. So I want to talk about some of these things, but this review won't be exhaustive. But we're going to cover a lot in the next few minutes. So when we talk about kratom, the active ingredient is said to be a compound called metragenine, and you'll often hear that said to be the active ingredient. There's another compound out there in the plant called 7-hydroxymetragenine. Both of these are often used as being the main active ingredient here. However, I want to point out that when you're using a whole product, a whole plant like kratom, you're most likely getting a bunch of so-called active ingredients. So be aware that it's just not metragenine or 7-hydroxymetragenine. As we learn more, we'll figure out more of what these compounds do in the body. But across the board, I can say that at lower doses, kratom has a stimulant-like effect, and at higher doses, it has a more calming and sedative effect. That's pretty much well known. My question when I hear all that is, what constitutes a low dose? What constitutes a high dose? That's something that we need more research on. So when we talk about the research on any topic, my litmus test is I want to see what's out there in the literature, and I go to the National Library of Medicine, and you can do this too. You go to pubmed.gov, type in a word, and see what studies popped up about it. So when I did that for kratom, I found a whole bunch of test tube studies and petri dish studies and some rat and mouse studies. I didn't see a lot of people studies, and that is an issue for me. That's also going to limit how much information I can give you today. What we know about this product is often limited to what happens when somebody goes to a doctor or goes to the ER or something like that, and we'll talk about some of that in a minute. But the human research on kratom is severely limited, and that is a problem. The biggest issue when it comes to kratom is people will talk about how it can reduce pain in the body. And one of the reasons for this is that metragenine looks like an opioid drug, and it can bind to opioid receptors. So if it binds to the opioid receptors, it makes sense that it would help decrease pain levels. And many people do report a reduction in pain when they take this herbal preparation. So that makes perfect sense, because if it binds the receptors, it's going to do something. While it's marketed to help on the internet for a variety of different issues, one thing that popped up on my radar fairly recently was diabetes. And I wondered at first why. And then as I did more digging, I found that people were saying that metragenine might help the cells absorb glucose better. And if it could absorb glucose better, that's going to lower blood pressure, blood sugar levels. That sounds all great, except that where is the human research? The only research I could find on kratom lowering blood sugar levels was a study of rat cells, where they basically dripped some kratom on the cells and found that they uptook the glucose better. And while that's really intriguing, I'd like to see a study of 100 or so diabetics. Let's randomly give them kratom or no kratom and see what happens in a couple hours, a day, a week, etc. That study's not there yet. So for the diabetics reading this or watching this right now, I'm going to say go talk to your doctor, especially if you take any diabetes medications. A lot of people in the gym like to take pre-workout supplements, and if we remember that kratom in certain dosages can have a stimulant effect, so some people will wonder if kratom will make a good pre-workout. Let's wait for research. There isn't any right now, so I can't tell you if kratom is going to make you run faster, jump higher, or lift heavier weights, or have a better workout. Nobody can at this point. The only thing you're hearing is from people who say it worked for them. Well, that's wonderful, but what worked for them might not work for you, and the dosage that worked for them might be too much or too little for you. Again, I want to see some better research on kratom and exercise. Hopefully some graduate students are watching us right now, and I just gave them a good idea for their master's thesis. Hint, hint, wink, wink. So is kratom addictive? I'm going to say probably in some people it is. Here's a survey of 170 regular kratom users, and 84% reported moderate pain after they stopped taking it. 46 reported sleeping problems after they started taking it. The side effects from stopping kratom seem to be greater in people who took more than 4 glasses of kratom tea or juice per day. So apparently it makes sense. The more you take, the more side effects you might see, and the more addicted you might become. When it comes to side effects, again, we're limited by the research that we have access to, and I don't see a lot of human research out there. Most of what we know about the side effects come from people who checked themselves into a hospital and said, hey, this is happening, that's happening. But regardless, I'm going to say I think the side effects are going to vary according to, what kind of medications are you taking, how long have you been taking kratom, do you have any other existing health problems, does the supplement or product you're taking of kratom contain anything other than kratom? These are all things that could play a role in the side effects that you might experience. General recommendations when it comes to almost any supplement that I'll review. If you're breastfeeding or you're pregnant, go talk to your doctor first. I personally wouldn't take it, and I'll talk about why that is in a second. If you're pregnant or nursing, if you operate any machinery or you drive, definitely don't take kratom, because remember, it can have a sedative effect. Before having surgery, stop taking kratom at least 2 weeks before surgery. That's because kratom may have a blood thinning effect, and that could affect the surgery that you're about to have. And if you take any medications, talk to your pharmacist. As I'll show you in a moment, kratom can interfere with a variety of medications. Side effects that have popped up in the literature over the last few years are a bunch. There's everything from dry mouth to seizures, nausea, liver problems, breathing difficulties, etc. These are going to vary according to, again, how much did you take, how long you've been taking it, did you mix it with anything, etc. Generally speaking, take less than you think you want to take at first, just to see how you personally respond. That's going to cut back on any side effects that you might have. And again, talk to your doctor or pharmacist. Researchers in Malaysia looked at 77 people who were kratom users and non-kratom users, and they noted that those who used kratom had higher LDL and HDL levels, LDL being the bad cholesterol, HDL being the good cholesterol. So some might say, wow, do they cancel each other out? If it raises your good and your bad cholesterol, might that mean a nil effect? It's possible. There's not a lot of cholesterol research when it comes to kratom, so I would say if you're going to be taking this, get your blood done, and let's see how your good and bad cholesterol and total cholesterol responds to it. These same researchers took a subset of these 77 people and looked at testosterone levels. They didn't see any change in testosterone, no elevation, no decrease in testosterone levels. Again, that's just a small sampling of these individuals. If you're concerned with testosterone levels, get it checked before you try kratom, and then do it a month later. Let's see if anything changed. So speaking of testosterone levels, here is a case report of a 42-year-old guy who is a regular user of kratom. He developed low testosterone and low sex drive. Got off the kratom and everything rebounded. Everything went back to normal. So, I don't know what effect this is going to have on testosterone. All the more reason to get your blood panel done first before you try it, and then maybe a month later to see if anything has changed. Here's our case report. It's a very controversial case report of a 27-year-old police officer who died while taking kratom. His autopsy report said he died of hemorrhagic pulmonary edema, blood in the lungs. He was taking a very high amount of kratom. There was, I believe, 5 times the amount of kratom in his system that is thought to be safe in humans. But regardless, I know this is controversial, but I want to throw this out to people. There have been some deaths associated with the use of kratom. They are controversial, but they do exist. I want you to consider this when you try this product, if you are going to try this product. Another report of a 25-year-old guy who developed liver problems 2 weeks after trying kratom. He began with 1 to 2 teaspoons of kratom a day and then increased it to 4 to 6 teaspoons thereafter. And it was 5 days after he stopped that he got the liver problems. So all the more reason that, I think less is more when it comes to this product. And if you experience any kind of liver problems whatsoever, you think you're getting liver problems, stop immediately, go to the doctor, go to the hospital, and let's see what's going on. Here's a report of another guy who got liver problems after using kratom. Now, many people will say, but Joe, he was taking Tylenol at the same time. Yes, but there was no Tylenol in his system when he had his blood done at the hospital. So was it a combination of Tylenol? Was it a combination of kratom? Or, we don't know. We just don't know. But I want to throw this out to you and say, hey, if you are taking any kind of medications, you definitely want to think twice before you're combining it with kratom. Fortunately, he got better after he stopped taking it. This, for me, seals the deal on whether or not kratom is addictive. This is a report of a woman who was taking kratom throughout her pregnancy. She gave birth, and 2 days after giving birth, her baby started having withdrawal symptoms. So, again, you're pregnant. I don't think you should be taking kratom at all. And when people say kratom is not addictive, this baby was addicted to kratom. So, for me, the idea of whether it's addictive or not, case closed. In many people, I think this can be addictive. In terms of drug interactions, again, if you take medications, you want to talk to your doctor first. Metragenine can interfere with an enzyme called the P450 enzyme. This is something that is involved with a breakdown of many drugs in the body. So sometimes the drugs will break down too quickly. Sometimes the drugs will break down not fast enough. Either result could be a problem. Some medications that could be interfere with kratom that go through that P450 enzyme system. You've got insomnia drugs, AIDS drugs, Alzheimer's drugs, Viagra, cholesterol drugs, antidepressant drugs, codeine, etc. The list goes on. These are not the only ones. Again, I want to reinforce the issue. If you take any medications, you want to think twice before you're taking kratom, and definitely talk to a pharmacist. Definitely talk to your doctor first. I can't tell you how much is safe, and that's because there's no good human research on this product yet. I know eventually that's going to happen, but not right now. So take with a grain of salt the dosage instructions you see on the internet. These people who are recommending that you should take this, you take that, they don't have science degrees, they don't have medical degrees, they didn't do the research themselves. They're telling you what worked for them. That may not be what works for you, so be careful. Summing up, I want to see more human research on kratom. Right now, it's not there. Eventually, that's going to change, and we're going to see some better studies. But right now, I don't see a whole lot. It's mostly test tube and rat and mouse studies. I do believe, based on what I've seen, there is going to be a reduction in pain in some people, but that's going to vary according to what kind of pain you've had and what's causing it. The optimal dosage for reducing pain or doing anything else, unknown. That goes right back to the lack of human research. If you have any kind of medical conditions, you want to talk to your doctor and pharmacist first. I see no evidence it helps exercise, but again, lack of evidence. Side effects, I do think side effects are going to be possible, but that's going to vary from person to person. I do think over time you may need to take more of this product. Some of the case reports I saw noted that people started taking more and more over time because what originally worked didn't work anymore. And also there is evidence kratom is addictive. I don't believe anybody anymore who says it's not. I think there are people who will become addicted to this. Does it mean everybody will? No, but some people might be. So if you take any medications, again, go talk to your doctor or pharmacist. So that's basically it. I'm Joe Cannon. If you want to see the entire review, which covers everything, it's more than 5,000 words. Go to supplementclarity.com/Kratom hyphen review, just supplementclarity.com, Kratom, you'll see it. Hey, I'm Joe Cannon. I hope this has been of help to you.